Sudhir for the Thank you, Dr. Sudhir, for having me as a speaker here again today. We have already have many webinars together, and I must congratulate Academy of Dental Careers for presenting so many webinars with so many mentors all over India, and imparting free dental education to the dentists all over India and abroad also. Really hats off to you. So let me can mute themselves. Can you help muting them? Yeah, I think now everyone is muted. So can you hear me? Can everyone hear me? Dr. Sudhir, am I audible? But I can't hear you.
A little more if you can louder, little more. Not you're audible, but little more if possible. Rest is fine.
Okay, okay. So passionate to make people look younger and make them more beautiful. I am a facial esthetician, an orthodontist, a mentor, and an author. So as a founder of Aesthetic Institute of India, I empower doctors across the world to incorporate facial aesthetics, helping them give new wings to their practices. So just starting with my webinar. Okay. So that's the my institute, Aesthetic Institute of India. So we have yesterday was my 50th batch. That is, we celebrated the golden jubilee of our batch of the Institute, Aesthetic Institute of India. So just today when I opened the Facebook, this picture came across me. So what people notice when they first when they meet someone. So the first thing people notice is your smile, then your eyes, and then your smell and the clothes and the hair. So being dentists and being facial estheticians, we can very well craft the smiles of the people. So they say 47% is the smile which is encountered first. So out of the 47% of the smile, if we take it as 100%, almost 50-55% role is played by your teeth, in which we are well versed by smile designing. We can correct them so much by so many latest techniques. Plus, the rest of the 50% is by your perioral areas, that is your lips, the marionette lines, the nasolabial folds, the cheeks. All these things, all the soft tissue structures also help you in giving a beautiful smile. So along with the dentistry, if you are going to incorporate facial aesthetics in which you can improve the lip fullness, in which you can improve the lip color, in which you can improve the wrinkles around the lips, that is the nasolabial folds, the marionette lines, the smoker's lines. So all of these, if you can make them more beautiful, so nothing like that. So people will obviously like to come to you for the aesthetics as well as dental things. So combining aesthetic dentistry with facial aesthetics under one roof, that is the dentofacial aesthetics, is the future. So we should always keep trying something new, because if you keep doing the old things, the life becomes boring. That is my mantra of life. So keep learning new every day, something new. So welcome to the Aesthetic Institute of India. So now we are going to start actually the facial aesthetics. So whenever I start my lecture, the first question that is bombarded upon me is, isn't that Botox and fillers are a plastic surgeon's or a dermatologist's job? But I would say that people all around the world, like the doctors all around the world, the ophthalmologists, the neurosurgeons, even the nurses, the gynaes, the ENTs, everyone is using Botox in some way or the other in their practices. So why not aesthetics with our general dental practices also? So just to encounter some questions, like I know many people here sitting here listening to me, they must be having this question: is this practice legal? So to answer your questions, I had once put an RTI. I had filed an RTI where I had asked the MCI, so whether all these procedures are a dermat's domain, so only a dermat can do them. So what answer I had got from them was, it is in front of you, that they had posted me a link of the MD dermat syllabus, where they had told me that you can go and check this syllabus. If these are under the syllabus, written in the syllabus of MD dermat, then obviously it is their domain, otherwise it is not their domain. So when you check the MD derma syllabus, nowhere in their syllabus it is written that the Botox, the fillers, the PRP is under their syllabus. Believe me, all my trainings which I had after my graduation, any additional setup, because all these injectables, that is the botulinum toxin, the fillers, the PRP, they do not require any much armamentarium, because the patient then says to you, yes, I want to go for this treatment. You can just order that product on to the company. The company will deliver it to you, and that product you have to inject into the wherever the indications are in the patient. So in a way, it doesn't require any much investment, and the same setup where you are doing your dental practices, you can practice these injectables there itself. Plus, you already have an existing patient pool with them, so with you, you just have to convert your dental patients into cosmetic patients. Plus, all these procedures are lunchtime procedures. That is, when a patient comes to you, he or she can get it injected and leave without letting anyone that something has been done on the face. Plus, we all are experts in giving injections. We all know the anatomy, physiology of our head and neck. We just have to learn the material, the different materials, their composition, their plane of injection, their longevity. So all the material has to be studied separately. Rest, the anatomy, the physiology, all the systems of the head and neck, we have already studied. We just have to revise them and get back fresh into our minds. Plus, the aesthetic
10
practice is
minutes
much more lucrative than the other routine dental procedures.
वॉल्यूम करके 2 minutes से सर नो
All of you can you please mute your mics? Yeah. Okay. So those of you who have any questions can just write up in the chat, and then we will all take up together in the chat. And if you want to specifically answer a question, anything, you can raise your hand. We'll be more than happy to answer it. Okay. So for learning, there is no age bar. So you have to take a training before you go into these procedures like Botox, fillers, thread lifting, and definitely I've seen lot of dentists going such a nice transformation after doing these courses. So the fundamental principle behind the facial aesthetics is that we just involve 5 hours. Not here we have written 4 hours, but we go for 5 hours. That is, first of all, relaxing your facial muscles with the botulinum toxin, then restoring the facial volume with the synthetic fillers. Wherever there is a loss of the volume, we inject fillers. And wherever there is sagging of the tissues, we tend to lift the tissues with the help of threads, or it is also known as the mono threads, cork threads. There are variety of threads available. Then we have the rejuvenation of the skin with mild therapies like platelet-rich therapy, mesotherapy, some laser, some peel. So there are lots of things that you can do under the facial aesthetics. So before we come back, before we go to the next slides where we study the Botox fillers, how to inject them. So I would just like to give an introduction of the skin structure. So if you consider this much portion, or you can consider the room where you have the floor as your this thing periosteum, and the top, that is the ceiling, you can have it as your skin. So from the skin, if we start from the skin, as we know, we have it has 3 layers. That is the epidermis, dermis, and the subcutaneous tissue. So the epidermis then again has various layers like I need not go into details of those, but after epidermis, dermis, then we have subcutaneous tissue or the superficial fat layer, and below the superficial fat layer is the musculoepineurotic system. That is all the facial muscles, they lie beneath the superficial layer, and below the superficial layer of the fat we have muscular layer, and below the muscular layer we have the deep fat pad. So the muscular layer is embedded between the superficial fat pad layer and the deep fat pad layer, and from the base, that is from the periosteum to the skin, there are various tree-like structures which are known as ligaments which hold the skin tight. So as we grow maturer, these ligaments, they tend to become weak. So then they are no longer able to hold the skin in a taut manner. So when these ligaments, they become loose, your skin tends to become loose. And these fat pads, they move to certain other positions like this buccal fat pad, which the other fat pads which should have been here, they tend to come down because of the gravity. So the fat pads reposition themselves. The accumulation fat pads appears near the jawline, that is near the, they are also known as the jowl. So our face tends to become inverted like this, which where the at the younger age we have lot of uh, fullness in our cheeks, and this fullness in our maturer age goes down to the lower third of the face. So we tend to, what we try to do with the facial aesthetics is that we reduce this volume by giving injections here for the Nefertiti lip, for the sharp jawline, or for the masseteric hypertrophy. So we tend to thin out this area and we tend to accentuate this area with the facial fillers. So because today most of our topic is within the Botox, so we are going to study the Botox today, because last time we had a general webinar, before that we had a webinar especially on the PRP, and then before that we had a webinar on fillers. So each time we have a different topic in our seminars. So what is botulinum? So botulinum toxin is a toxin which is obtained from the bacteria Clostridium botulinum, and this comes as in the vial form. The vials come in 50 units also and the 100 units also, and this toxin, this causes the relaxation of your muscles, and when it causes the relaxation of the muscles, the wrinkles start disappearing. So if you can appreciate the wrinkles on the cheeks of this beautiful lady, so after giving the Botox injection, those wrinkles have been relaxed. So see these wrinkles on the forehead, those forehead wrinkles, which there were deep wrinkles on the forehead, those wrinkles have been relaxed by the injection of the botulinum toxin. So apart from the facial aesthetics, the botulinum toxin also helps in various other uses like chronic migraine. Then we have pathological clenching, the bruxism, trigeminal neuralgia, periodontal surgery. After any surgery, we need to give some rest to that area. So these Botox injection, they help in the relaxation of the muscles, surrounding muscles, so that wherever you have done an implant surgery or a periodontal surgery, the muscular force should not come to that area, and that area should be in a rest position. Then we have in the orthodontic relapse cases, being an orthodontic, so many cases come to me which face a repeated relapse. So in those cases, there is a hyperactive mentalis muscle. So if we relax the mentalis muscle with few injection of the botulinum toxin, so that relapse can be prevented. And apart from the dentistry, there are so many diseases or so many areas where the Botox has been used, like it has been used in the depression cases, the heart trouble cases, the migraines, the erectile dysfunction, back pain, sweaty palms, drooling. And this is how the Botox has become the drug that is treating almost everything. And this was on the cover page of the Time magazine. So the Botox comes in various brands like Siax, the Botox by Allergan, then Dysport by Galderma, Nabota by Dr. Reddy's, then we have Stanox by Hufix Sciences. So all these are the brand names of the botulinum toxin. though the Botox itself is very famous because Allergan was the company who had brought Botox. So the way we use आज कौन सा Colgate use किया. So the same way people use Botox कौन सा लगा रहे हैं. So Botox is one brand that is by Allergan. Rest all are the other brands which are coming up. So because they are new, so people don't know them. Then we have the types of wrinkles, that is the dynamic lines and the static lines. So Botox works only on those lines which are dynamic lines. That is the lines which come on action. Like when I'm raising my forehead, if I'm getting the wrinkles here, these are dynamic lines. If I'm doing my snipping and if I'm getting the lines here, these are bunny lines. So if I'm smiling, if I get the lines around the eyes, which are crow's feet, so all these lines are dynamic lines, and the Botox can treat only the dynamic lines. It cannot bring an improvement in the static lines. Static lines like, for example, the tear trough, the nasolabial fold, the marionette lines, the lines which are visible when the patient is sitting in front of you without making any movement. So those lines have to be filled up like a valley, and those valleys are filled up with the gel-like material which is known as the fillers. And the fillers come in various materials, like most commonly used is hyaluronic acid. It goes and fills up those areas and it swells up those areas so that your deep depressions or the valleys, they start becoming raised up and they become into a smoother surface. So this is examples of the wrinkles like forehead wrinkles, frown lines, crow's feet. They all are dynamic lines. And the perioral lines, if they are in a younger phase, they are dynamic lines. And in a maturer phase, they become static lines. And all of those lines which are dynamic in the younger age, they tend to become static in the older age. So whenever the Botox vial comes to you, it is almost empty. So when you will see a Botox vial, it doesn't have anything. Just a minute, we'll take vial. So I'll show you one vial. When the vial new packing comes to you, it is almost like a free, almost like an empty vial where you will not be able to appreciate anything in the vial. So you have to prepare it with the normal saline, and to prepare 100 units of vial, you have to mix it with 2.5 ml of the normal saline. So when you prepare it with the 2.5 ml of the normal saline, you are injecting 2.5 ml of the normal saline into the Botox vial, and that is giving you 100 units. So how to calculate those 100 units? So for those, we have insulin syringes which have the marking of 40 units. So just take care that insulin syringes in the market are available in two types, that is the 100 units and the 40 units. But we have to use only those syringes which have 40 unit marking on them. So each 1 ml of the syringe will have 40 marking. So we had prepared the Botox vial with 2.5 ml of the normal saline. So that is, if we take out the complete volume which we have prepared in the insulin syringes, so we are going to have 2.5 syringes of the insulin prepared with us. That is 1 ml, 1 ml and 0.5 ml, giving you 2.5 ml. At each 1 ml syringe has 40 units. That means 40 units, 40 units and 20 units. That is going to give you a total 100 units. So you have to calculate the number of units according to the units measured mentioned on the insulin syringes. Then for an example, I'm showing you this vial, that is the Stanox vial. So this Stanox vial is a completely new vial which I am opening in front of you. So when you open this vial, you will hardly be able to appreciate anything in the vial because this is completely empty. So to many doctors who are starting, they will tell me, ma'am, this vial is not correct because it doesn't contain anything. The company has given us the empty vial. But believe me, all these vials which have been sent by the company, they are not empty. They have a minute powder in them, which has to be filled with the normal saline. And because they have vacuum inside. So whenever you put the syringe in itself in the vial, so the vacuum itself will suck the saline into it, and that is a test whether the vial is okay or not. So if your saline which you are putting is being sucked on its own. So that means it is the correct vial. It has a toxin inside. So that means you are ready for this for the injection to be prepared, and then you just have to keep it for some time on the table. Do not shake it vigorously because it is a protein which can get denatured. So that has to be kept. That has to be the prepared saline has to be moved gently like this, and that has to be kept on the table for just 5 to 7 minutes, and that then you are ready to inject. So then we have the various muscles of the face, that is the corrugator, supercilii, the procerus, the frontalis. So for the glabular lines, when we are injecting into the glabular lines, so we have to inject into the procerus and the corrugator supercilii. So these are the two muscles which are the depressor muscles. So they tend to bring the eyebrows down and middle. So whenever we have to target the frown lines, we have to target these two muscles, that is the procerus and the corrugator supercilii. And then there is a frontalis muscle, which is a paired muscle, which is the only elevator of the forehead. So whenever we are targeting the eyebrow lift, when we want to do the eyebrow lift, or when we want to smoothen out the forehead lines, so then we have to target the frontalis muscle, which is a very thin muscle, and so our injection into the frontalis muscle has to be very superficial. And because the procerus and the corrugator are deeper muscles, the procerus is the deepest muscle, so we have to inject deep into the muscles at around 5 to 6 mm of the length. And corrugator is in between the frontalis and the procerus muscle, so this is around 2 to 4 millimeter in depth. So our injections have to be given in that length only. So then we have the glabular lines, the crow's feet, forehead lines, eyebrow lifts. So all of these conditions can be treated with the botulinum toxin. For the procerus, the landmark is where the ladies put their bindi. So when you draw a line from the medial end of one eyebrow to the medial canthus of the other, and the medial end of one eyebrow to the medial canthus of the other. So wherever these two lines join, that is the injection site for the procerus. And then similarly, we have a belly and a tail for the corrugator muscle, which has to be injected separately. So this is how the glabular lines pre and post is visible. So make sure that you do not have to inject beyond the midpupillary line in the lower third of the face, because if you do that, then it might lead to the drooping of the eyelid. Then you can also cover the crow's feet, and we can very well correct the crow's feet. Then we can do the brow lift. Then we can also treat the bunny lines, which I showed you when I'm sniffing. These bunny lines appear. So if I give an injection here and injection here, these bunny lines can be treated. And in some cases, some older individuals, the tip of the nose that tends to fall down with the age. So if we can give a small injection here of the Botox, this tip can be raised again, giving a youthful appearance again. So then we have the mid-face injections, in which we have the cobblestone appearance of the chin. So some people, you must have seen this cobblestone appearance of the chin is there, which gives them a very aged appearance. So if you give few injections, like just 2 units in the mentalis muscle on both the sides of the midline, so this helps to smoothen out the cobblestone appearance of the chin. Then we have the perioral lines or the lipstick lines or the smoker's wrinkles, because your lipstick tends to bleed into these lines. So the females usually hate these lines. So they are very much keen to get these lines treated. So if a patient is young, if the lines are dynamic, you can easily treat them with the botulinum toxin injection. But if the patient is older, maturer, then you have to treat them with the fillers, because then they tend to become the static lines. Then there are marionette lines. Marionette lines are the lines which run down along the corners of the mouth, which tend to make us look sad. So marionette is actually a name given to a puppet which has moving parts. So when these lines appear, this looks like very much like a puppet kind of appearance. So that gives us a very sad appearance. So to correct these, we give the injection into the depressor anguli oris. We ask the patient to say E, and when the patient says E, then along this line, in the center of this line, you can inject the depressor anguli oris for correction of the marionette lines. Then we have the mesenteric hypertrophy. With age, our lower third of the face tends to hypertrophy because in some bruxers or some dental disease patients, we tend to do repeatedly like the clenching motion. And when we do repeatedly, this lower third of the face tends to hypertrophy. That is the mesenteric muscle hypertrophies. And this mesenteric bulk can be reduced by giving around 20 to 25 units of the botulinum toxin into each site. So this is, if you can see the result from the first picture to third picture, that is after the second picture is from the 15 days from the first picture and then 15 days from the second picture. So you can see a sharp, well-defined jawline by giving a few injections of the mesenteric hypertrophy. Then we also can treat the gummy smile. So when an excess of gingiva superior to the maxillary anterior teeth is displayed upon full smile, it is known as gingival smile. So if the gingival smile is because of the hypermobile or hyperactive muscles, that is the zygomatic major, minor, levator labii superioris, alignesi, levator labii superioris. So all of these are elevators of the face. So if these muscles are hyperactive, then you can treat them with the gummy smile, with the botulinum toxin injection. Then there are many patients will complain to you for a very loose neck because when they talk, the neck looks very aged kind of appearance. So to treat that aged neck, we can give the injections into the platysmal bands of the muscle. We can ask the patient to say E. So when the patient says E, those neck bands may become visible. And then you can hold each of the neck band into your in between your finger and the thumb like this. And when you hold it like this, then you can mark symmetrical points at a distance of 1 to 2 centimeter. And into each muscle, into each marked point, you can inject around 2 units of the prepared Botox, which you prepared with a 2.5 ml of the normal saline, and giving these minute injections into the hyperactive platysma muscle smoothens out the neck like anything. This beautifies your neck, and this also gives a lengthening kind of appearance, as if the length has been smoothed, ironed, and giving it a longer appearance. So that is the Nefertiti lip, in which you treat the jawline, the mesenteric hypertrophy, and the platysmal bands. Then Botox can also be used as a micro Botox, where a very diluted dose of the Botox is injected superficially onto the faces to give it a very smooth, shiny appearance. And it is specifically given in those cases which have a very oily skin, because the Botox tends to reduce the activity of the sebaceous glands. Because sebaceous glands, as we all know, are lying very superficially. So when we inject very dilute dose of the Botox, that is the micro Botox, into the superficial layers of the skin, so this is going to cause the relaxation of the sebaceous glands. That is, the activity of the sebaceous glands is decreased, and that tends to decrease the sebum production on the skin. And next, using it as a micro Botox, you do not have to inject it on the drier skin faces, because this will tend to make them more drier and more itchy. So whenever a patient is complaining of oily skin, so you can easily inject the microbotox by drawing equal kind of squares, and into each square you can inject around 1 to 2 units of the diluted dose of the Botox. So Botox benefits are not limited just to wrinkles. It can be used to treat the oily skin, the acne-prone skin, and also many other diseases which we have discussed, like pathological clenching, the bruxism, the chronic migraine, the trigeminal neuralgia. Then also a very important condition which is known as hyperhidrosis, that is the excessive sweating of the palms and even the head and even the feet. So what is the right age to start Botox? So I would say that wherever you feel that the patient needs, it is a need-based treatment. So whenever a patient needs a treatment, you can inject. So it is not the biological age which is which is the chronological age which is more important. Rather, it is the biological age which is more important. So how long will it take for the procedure? The procedure takes around just 15 to 30 minutes. It's a lunchtime procedure. And how soon can I see the results? The results are visible on the third to the fourth day. Uh, uh, Before getting into this, that why should the result be seen on the third to fourth day? I would just like to give you a brief explanation of how the Botox works. The Botox works by deactivating certain proteins. So those proteins are responsible for bringing the synaptic vesicles containing acetylcholine into the muscle. So whenever an impulse is coming on the nerve, those proteins, the snare proteins, they bring the synaptic vesicles close to the muscle, and that causes the release of the acetylcholine from the synaptic vesicle. And that acetylcholine, which is a neurotransmitter, causes the relaxation of the muscles. It doesn't let the muscle contract. The muscle is in a kind of smooth or flaccid paralysis, that it is not contracting. When it is not contracting, the muscle remains stretched as if it has been ironed. So those proteins which need to be deactivated, that takes around 3 to 4 days. So that is why the result of the botulinum toxin comes after 3 to 4 days. It is not like that a patient has come to you, you have injected the Botox, and immediately the result will be visible. It's not like that. You at least 3 to 4 days are needed when you start seeing the result, and the peak comes on around seventh day. So will the lines worsen if I discontinue the Botox? So that is one question that is asked by almost every candidate who comes to me for doing the course, or every patient who comes for a consultation for the Botox. So the lines will not worsen at all if you discontinue the Botox. It is just that they will come back to the point where they were. They will not worsen. So wherever we had started, those lines will be there. Since how long the results will last, the results last for almost 4 months to 6 months. You can tell the patient from 4 months to 6 months, because it varies according to the types of actions the patient is moving, the types of action that patient is bringing, like the frowning motion, relaxing motion, smiling motion. What is the kind of profession into which the patient is. Those who are making repeated movements, like the classical dancers or the classical actors, so those they tend to have less distinct duration of the botulinum toxin. Then how painful is the Botox? Botox is actually not painful, because this is used with a very fine needle, that is the insulin syringes, the gauge of which is very small, and so these are not very painful. And before the injection, you can always numb the area with the numbing agent, like the Numbex or the Prilox or the Top Lab. There are so many numbing agents available. So before injecting, you can just apply a layer of the numbing cream, and you can cover it with a cellophane sheet, that is known as you are numbing it under occlusion. So that makes the patient very comfortable. Also, if you distract the patient, if you ask somebody in your team, like your assistant, to just tap the head while doing the injections, so that is kind of distraction, with which the patient will not be able to feel the pain too much. Then Botox is temporary. Why should I use? That is another one question. So if you really want to get younger, if you really want to look younger, so what else is the technique other than these non-invasive procedures? So other than these non-invasive procedures, only plastic surgery is the solution. And plastic surgery, as you know, is much more invasive. It involves the hospitalization. It involves a lot of money, and it involves a lot of rest. and still it is not permanent. After few years of plastic surgery, you again tend to bring those wrinkles back, because aging is a continuous process. It is there, it has to come there. We cannot deny that. So we can just delay that aging process. So by these non-invasive procedures like the Botox, fillers, and the PRP, we can just delay those aging procedures in a very subtle way. So what is the post care which has to be taken? The post care is that you do not have to lie down for 4 to 5 hours, because if we have to inject in a particular muscle, then the botulinum toxin should remain into that muscle only. Like for example, if we are injecting the procerus and the corrugator supercilii for the glabellar lines, so we do not want the product to go into the frontalis muscle in the lower third of the forehead, because if that product accidentally goes into the forehead, into the frontalis muscle, this eyebrow will tend to droop down. So where I was planning to do an eyebrow lift, and if accidentally you have injected wrongly into the frontalis, you have to inject into the procerus and corrugator. But if your injection has gone into the frontalis in the lower third, so this eyebrow will tend to droop down. And if at all you are doing it correctly and the patient goes and lies down, or if the patient goes and rubs it, or if the patient goes and does yoga, or if the patient goes and does gets a facial done, so that product you had, which you had put into the procerus and the corrugator, tends to flow into the frontalis. So your eyebrow will no longer be lifted and it will droop down. And on the third day, the patient is going to come back to you that, doctor, you had injected botulinum toxin for me, but for me it has brought a wrong thing, that my this thing eyebrow has drooped down. I am not able to open my eyebrow very much. So what can I do now? So those cases you have to treat very carefully, and there is no antidote to the botulinum toxin. So it is in a way boon also and bane also, that if any side effect comes, then the patient has to live with that for another 3 to 4 months. And it is an advantage because the patient is coming to you repeatedly for those injections. So it is a repeat business. So just taking few care that you have to inject wherever there is an indication, then only you can be successful in giving your proper result. So this is one of the books written by me, that is the botulinum toxin, beautiful boon. So this is a book written with a view to help my dentist friends, because in our graduation schools the very little is taught about the botulinum toxin. There is hardly another, I think, 2 or 3 pages covered at the back side of the oral surgery books where the Botox injections are mentioned. But for my dentist friend, I've specially written this book in which I have covered, starting from the right from the composition of the botulinum toxin, the side effects, the contraindications, the muscular anatomy, where into which muscle it has to be injected, and for each muscular anatomy, that is the procerus, the corrugator supercilii, the orbicularis oculi, orbicularis oris, then the masseter, the various case studies for various indications like the gummy smile, the masseteric hypertrophy. All of my personal cases are also there in this book, which can help you bring out this botulinum toxin into your practices. So if you are starting your practices with the Botox, this is a very good, very in small, all the things are mentioned very clearly in a very simple language, which any general dentist can adopt in his or her practice. So for those of you who are interested in learning these procedures with the hands-on on the patients, we have our upcoming batch that is on the from 20th to 26th of June. So which will have 3 parts, that is part A, part B, and part C. The part A will cover all the facial anatomy, the Botox procedure, the other injectables like the fillers, the PRP, then we have moles and tag removal, then we have specific indications like thread lifting, then the cheek and chin augmentation, vampire facial fillers, lip fillers. So all of these are covered in the first 3 days. That is the part B. part A, and then in the part B we do semi-permanent makeup, that is eyebrow mapping, microblading, this thing, ombre brows, powder brows, and various other the indications like the scalp pigmentation. Then we have also the vitiligo pigmentation. So all of this is covered in part B, and part C is along with my dermatologist, Dr. Chandni. So she's a MD Derma. So she takes all these topics like the skin types, skin formulations. So if a patient has come to you for a skin rejuvenation, which products you should prescribe, like which facials you should give, which vitamin C you have to prescribe, which sunscreen you have to prescribe, because sunscreens, like, they come in a huge variety. There are physical sunscreen, there are chemical sunscreens, there are water-based sunscreen, there are gel-based sunscreen. So you have to have that complete knowledge before the patient is coming to you, because all of this knowledge is given on the Google, and the patient who is coming to you is smart enough to have all the knowledge from the Google, and he or she is coming to test your knowledge. So when you are telling the patient for injectables like fillers and the Botox, and if you do not know the basic structure of the skin or the basic skin products which should be used, so then you are in a problem. So all of those things are taught in our part C, and this part C also covers the other indications like the lasers, the photofacial, the hydrofacial, the medifacials, all the medical facials. So this part A and B and C is a complete mastership program which is affiliated to the University of Messina, Europe. And then we have our upcoming batch in Jaipur, that is for 3 days, in which we will be covering part A and a little bit about the other parts. That is on the 1st, 2nd, and 3rd of July. Then we have another workshop in Jammu, which is in the mid-July. That is on the 15th and 16th of July. And then we have the next workshop in Chandigarh, which is from 29th to 31st of July. And after completing the workshop, that is the mastership in facial aesthetics, that is complete doing of part A, B, and C, then you are also eligible for an international mastership in facial aesthetics, which is held in Europe. So every year we have a batch of batch of doctors who do the international mastership from Italy. So this time we are having it in Naples. So that is in September. So those of you who have done the facial aesthetics, either from our institute or from any other mentor, they are most welcome to attend this international mastership in Italy. So there we have a complete team with Dr. Antonio, then Stefania Vanara, who is the mastership, who is giving the mastership in permanent makeup. Then also we have another doctor, another surgeon, who is in our team, who is going to help us in all the advanced procedures of the facial aesthetics. Like we are including that the lipolysis in this. Then we are also including the long hair transplant in it. So there are lots of new things about which you get a very little knowledge in the courses in India. So we have specially kept this international mastership with a view to teach those topics about which the exposure in India is very less to the general dentist. So learning is the only thing. The mind never exhausts, never fears, and never regrets. So keep learning new things every day. And thank you for your patient listening. So now we have 15 minutes left with us. So I would like to attend to few of the questions which must be there. So Dr. Sudhir, can you just tell me what are the questions, or if anybody can raise their hands and ask me the questions, I would be most happy to answer those questions. Dr. Sudhir, are you there?
Thank you so much for the wonderful session, ma'am. Once again, as we requested in the last webinar that we will have you once again after May, and you're here again today. Thank you so much. And it was a very nice session. It was helpful once again with a new topic for Botox. Like every time we have a similar topic in facial aesthetics. We had today a lot of people here. So congratulations for your success. I hope we few of the people here today will see you in the course also, and the sessions online going on. Anyone of you wants to interact, you can switch on your camera. You can ask questions. You can discuss your cases also. Please go ahead. Switch camera and one-to-one interaction is possible here. Please go ahead. Anyone has any questions? Few people raised hand during the webinar. So
there's a question written in the chat box also. Can you repeat the right age to start the Botox? So considering the age, I told you that there are two types of ages. One is biological age and one is chronological age. So biological age is how much we are appearing to be. So if a girl comes to you in 20s or 22, 23, so and if she is having she is complaining about this crow's feet, or she wants to have an eyebrow lift, so you can easily inject in that patient. So it is not the chronological age like 20 साल से नीचे नहीं करना या 18 साल से नीचे नहीं करना. It is not like that. Preferably we try to do it above 18, but whenever the patient is requiring any treatment, because this is an aesthetic treatment, so it is a need based treatment. So whenever the patient or the client is wanting that treatment and the age is above 18, you can inject. So how can we charge to the patient? The charges are normally according to the number of units charged. Because if you are injecting around 40, say around 50 unit of Botox, so each unit you can charge around 400 per unit, or you can charge 450 or 350 or 300. So the rate usually varies from 300 to 400 or 450. So if you are using around 50 units of the botulinum toxin, so on the least side you can charge around 300 per unit. That means 15,000 for the entire forehead, in which you are covering the glabellar lines, the forehead lines, the crow's feet. So all of those can be treated in the 50 unit Botox with 300 per unit or 400 per unit, whatever is your practice and which brand of Botox you are using. So accordingly, the charges can vary. So then there's another question. What all regulations and certificate is required by the dentist to start this cosmetology treatment in our clinic? So see, in India, there is no specifically board. There is no board which allows you to do this practice. So because I told you this is not in the MD Dharma syllabus, they are injecting. So this is in India also, there is no specific board which allows you to inject or not to inject. So it is by the latest guidelines of the DCI, it has allowed all the oral surgeons to inject for the aesthetic purposes also. And what an oral surgeon can do, a general dentist can definitely do. So you need not have any specific this thing what you had asked me, the all the rules and regulations. It is not like that any government is going to certify you for that. So that way you are lucky in India. So then you have, if I attend the June 20 to 26 mastership, will I be able to attend the international mastership in Italy? Yes, of course you will be able to attend. If you have this the complete knowledge of the injectables, that is the PRP, the botulinum toxin, the fillers, and then you have this thing, the permanent makeup and those medical facials and lasers, then you are allowed to go for the international mastership in Italy also. You're most welcome to do that. The charges for that will be 1.5 lakhs for the Italy course. Yeah. Anybody else? Any other questions?
If any course is attended, what about the post-course assistance? Is there any in assistance or post-course assistance?
Yes, Dr. Sudhir, we have a complete post-course assistance. We have all WhatsApp groups of the alumni. So you can put all your queries in the WhatsApp groups, and there is a Facebook group also, which is especially for the alumni only. So all of those who want to start their practices or who have done the courses from me, you can ask them. So we have a full post-course assistance in which we answer to every question which is put in the WhatsApp groups or the alumni groups, and we have complete case discussions also in those groups. So all those cases where you are little fearful, like how will I start, which markings I have to do. So you can always send me the pre-pictures of the patients. I can do the markings, I can send them to you. And if after doing, if you have any problem, any complication you are thinking about, I'm there to help you. So it's like that. So any other questions?
Also, we can share our cases with you online you can consult and guide for cases?
Yes, yes, definitely. We can do the online consultations too for our cases, for your cases. Then we have another question: how can we inject Botox for the gummy smile? So for the gummy smile, there is this thing you have to inject around 1 centimeter distal to the area of the nose and around 3 centimeter from the corner of the mouth. So this way you have 1 centimeter from here and 3 centimeter from here. So this is a point where you have all the levators coming, like the zygomaticus major, minor, then levator labii superioris alignus and levator labii superioris. So this is the point where most of the levators of the lip, elevators of the lip, they meet. So once you inject into this area, so that hyperactiveness of these muscles tends to become slower. So then the gummy smile is also a little bit it becomes subtle. So from where we can buy the Botox and the fillers, there are various dealers available. So all these products that are available at my institute also. So if you have any requirement, you can. I'm always a WhatsApp call away. Then what if a patient gets allergy? So most of these products, that is the botulinum toxin, the fillers, the PRP, they are hypoallergic. They do not cause any allergy because they are obtained from the natural resources, like the this thing. Botulinum toxin is obtained from Clostridium botulinum. So that is a natural product. Then fillers, that is again a natural product, which is again obtained from the bacteria. So the chances of hypersensitivity are very less. But even if those hypersensitivity reactions occur, then you have to give those anti-allergic and you have to treat them as like the way you treat for any hypersensitivity reaction, as we have studied in our dental schools also, for the local anesthesia also, and for the other drugs. But in routine, if when we are injecting the Botox and fillers and the PRP, we do not do any hypersensitivity reaction patch test because the chances are very minute. So charges to treat mesenteric hypertrophy. So it again depends how much units you are injecting. If you are injecting just 25 units, that is 50 units, then you will charge according to the 50 units. So it's basically the number of units you have to tell to the patient. Because if you tell to the patient that I will treat your this thing hypertrophy in 25,000 and you are planning to inject 50 units only, but if the patient does not get result in 50 units, then you have to put more units from your pocket. So who is going to pay for that? So it's always better that you tell the patient that I'm going to inject 50 units and I'll be charging for 50 units. And if you get the result in those 50 units, well and good, I will not charge more. But if you need to have more number of units, then we will charge according to your requirement. Then there is another question. Being a BDS graduate also, can I practice this, right? Yes, of course you can practice this. You have all studied the muscles of the face, and mesenteric muscle is a muscle of the face. And besides giving you this aesthetic indication, this mesenteric injection is also a therapeutic indication because in bruxers and in chronic clenchers, you have to inject the mesenteric muscle as well as the temporalis muscle. So you can go and inject mesenteric muscle. Don't worry. But just keep in mind that this is an off-label indication. If at all there is any trouble, any problem on the patient, from the patient side, then you can land up in trouble because this is not an online, this is not a FDA approved indication. So on your consent form, you should have it written that this is an offline indication. This is an off-label indication. So are there any contraindications for Botox? Yes, there are few contraindications like pregnancy, like any neuromuscular disorder, like any this thing, lactation and the ladies lactating. Then again, it is a contraindication. Not necessarily an oral surgeon. See, what an oral surgeon can do, a general dentist can also do. If you go back into your dental gazette, the first line there, which is written there, is that what a specialist dental surgeon can do can be done by a general dental surgeon also. So ma'am, please send the details of the course with fees. Yes, definitely we'll send you. You can just send me a hello on my WhatsApp. Then even mesenteric treatment should be Should be treatment again after 4 months? Yeah, you have to give a lot of injection into the lot of dose into the mesenteric hypertrophy. So this lasts for around 4, 5, 6 months also sometimes. So I think that's all. Only these were the questions. Any other questions? Please let me know if you have any other questions.
Consent form is necessary or not?
Pardon, Dr. Sunil, I didn't get you.
Consent form is necessary or not?
Yes, consent form is definitely necessary. You should have a consent form. Consent form के बिना बात नहीं बनेगा because patient तो आपको आके बोल देगा ये lines ये ऐसे नहीं थी ऐसे हो गया, but अगर आपके पास consent form है तो it is like consent form plus 3 pictures is also a must because patients have a very short memory. Every human has a short memory. So patient तो ये बोलेगा कि ये lines तो थी नहीं जो अब आ गई. So you should always show the pre-pictures also. Okay, this line was there. We have just corrected the other line. And if you want the correction this line, also I can do it in this way. So pre-pictures and consent form is a must. Any other question? Please let me know.
No, we have covered everything, ma'am. Fine.
Okay. So thank you so much, everyone, for your patient listening. And thank you, Sudhir, for being there on time and having all the audience with us and staying there very patiently by everyone. Any question you can put on my WhatsApp also. I'm there to help you anytime. And thank you so much. I can see many names: Dr. Shivani, Dr. Monica Singh, Dr. Deepti, Dr. Alka, Dr. Smita, Dr. Krishan, Dr. Sangeeta. So all of you are here. Thank you so much. Pleasure having you with us today, this Sunday morning. Thank you all. Okay. Thank you. Bye-bye.
Okay, we'll end this meeting. Thank you.
Yeah. Thank you. Thank you so much.
This meeting is a recorded session. If one is missing anything, you can attend on YouTube also, as well as the course brochures are also shared here in the webinar. Still, we will send you in person also, so you can connect on the contact number given on the brochures. So thank you everyone, and wish you all a very happy Sunday. See you in the next webinar.